Hundreds of scientists from around the world are gathering in Geneva to try and come up with a unified strategy on how to fight the coronavirus. Well, let's go live now to our two correspondents, Imogen Fuchs, who is in Switzerland for us, in Geneva, and in Beijing, Stephen McDonald joins us. And Imogen, first of all, to you, the WHO under huge pressure here to prove that it really is working hard to bring this virus under control.
That's absolutely right. And I think, having watched the WHO officials over the last 2 to 3 weeks, they are working really hard. We had a break this last weekend, or the weekend before, in fact, tracking the progress of this virus. They've sent a team to China. They're in daily contact with Chinese health officials and with health officials in neighbouring countries, Singapore, Hong Kong, Taiwan. So I think, yes, but what they're really keen to do is to make sure that they're doing everything possible to contain this virus, to pool the knowledge. That's what all the scientists are doing here today, the available knowledge about it, what works in the treatment of it, why it spreads, how it spreads, and to do all that without causing over anxiety, over alarm, things that could cause countries to take measures which might not necessarily be necessary and could cause a lot of particularly economic damage.
Hello viewers, we are in the HUG Geneva Hospital in Switzerland, and as you can see, we are reporting on the events and the activity or the information about the coronavirus that have arrived in Switzerland. Still in the hospital of Geneva, HUG, looking around to find out the information about the coronavirus in Switzerland. Follow me to see much nurses and doctors that will tell us much about this virus and the patients that have contacted this infection so far in the hospital HUG in Geneva, Switzerland today. Dr. Lawrence Kaiser, we hear from you.
Un nouveau coronavirus, en l'occurrence ici, c'est un virus qui existe chez les animaux et qui, pour des raisons qui nous échappent, parce que ces petites bêtes, elles ne parlent pas, elles ne nous donnent pas leurs intentions, mais là, il y en a un qui a décidé de passer de l'animal à l'humain. Vous avez eu la rencontre d'un rongeur, probablement, ou d'une chauve-souris et d'un humain. Le virus qui infectait cet animal, hop, est tombé dans le nez ou dans la gorge d'un humain, et il a commencé à faire sa vie, à se répliquer. Ce faisant, il a continué à rendre des gens malades, et comme il se réplique en quantité suffisante, il s'est transmis d'une personne à une autre.
Alors chez l'être humain, ce coronavirus est à l'origine de difficultés respiratoires, donc de symptômes respiratoires, de toux, de difficultés à respirer. On peut avoir des douleurs dans les muscles, les articulations, des mal à la tête et parfois des diarrhées. Les symptômes principaux, c'est des symptômes d'infection des voies respiratoires et notamment la toux. Et ce virus peut causer des pneumonies.
In Switzerland, Geneva's international motor show's been cancelled after the government banned all events involving more than 1,000 people.
It's now just under 2 months since the start of the coronavirus outbreak, and cases of the virus, now labeled COVID-19, continue to rise. More Canadians testing positive for the deadly virus, 1 in Ontario and 2 in BC. Airports across the nation, meanwhile, telling all incoming passengers to monitor themselves for symptoms.
I will say that we are particularly closely watching some countries where there seems to have been quite an increase in cases.
The virus arriving in Italy with force. Cases surging from 3 to more than 200 in a matter of days. 7 deaths now confirmed in the country, with fears of the infection spreading.
Me and my mother and parents, friends are worried, very worried. It's dangerous.
With many worried those concentrated pockets may signal a new stage in the spread of the virus.
In the biggest city of Africa's most populous country, the first case of coronavirus is worrying news. An Italian man flew into Lagos, Nigeria from Milan earlier this week.
We have started working to identify all the contacts of the patient since he entered Nigeria, and even those who were with him on the aircraft.
Nigeria's large population and high rates of poverty make it vulnerable to outbreaks like these. When the World Health Organization declared the virus a global health emergency last month, it was because of concern it could hit countries with weak health systems. On Friday, the WHO upgraded the risk of the virus's global threat to very high.
And I think this is a reality check for every government on the planet. Wake up, get ready. This virus may be on its way and you need to be ready. You have a duty to your citizens, you have a duty to the world to be ready.
Nigerians are worried, especially those in Lagos where the case was reported. Earlier today, the governor of Lagos State had a live conference where he spoke to Nigerians and Lagosians, asking them not to panic because this particular case is being addressed. But just some couple of hours, just to give you an update before I came on live with you, 28 people at the moment have been quarantined in the state so far, talking about those who had direct contact with the Italian when he arrived at the factory in a place called Ogun State, which is a neighboring state to Lagos State. It's a cement factory called Lafarge, and the company has already shut down that factory as they try as much as possible to see those who were in contact with this man who came in from Milan, Italy. The Lagos State government has a facility that can take about 100 people. So now the man who's come down with the virus is the only one in the facility, meaning they have about 99 beds there unoccupied. For the 28 that have been quarantined, they've just been watched closely to see if they'll come down with the virus. So far, I think the medical professionals at the Center for Disease Control in Nigeria, they say they're ready. And the Minister for Health has also been speaking to people. But again, there's something that has happened in Lagos and a couple of other states and cities, and it has to do with the panic which the government has warned against. If you go to shops, and especially medical shops around Lagos in Nigeria, hardly would you be able to find a hand sanitizer to buy. And they've gone out of shop. And of course, the face mask is also in scarce demand. So in so many other places you go to in Nigeria, like the electricity company where I presently consult for, the company has tried as much as possible to also give out nose masks. So where we are at the moment, before I came in here to stop to take this interview, we were all giving hand sanitizer. So I think the awareness is creeping on the people, coupled with the panic, which people trying to liken it with the fright and concern they had when we had Ebola. As you rightly said, Nigeria was able to manage Ebola, so the doctors here, they say they're also ready. But so far, it's just one man down with the virus, while 28 at the moment are in a facility being washed.
And trains are being disinfected in a bid to slow the virus's spread.
The city still seems to be a little asleep. in a negative way. I don't see many people around, and I'm sorry to see that people have been so alarmed.
And in Iran, instead of crowds of worshippers, there were workers in hazmat suits in this holy shrine in Mashhad. Friday prayers were cancelled across much of Iran, where the virus has killed dozens of people and infected.
Health officials now believe the Wuhan coronavirus can be transmitted from one person to another.
This is ground zero. Security asked us to stop filming.
Police just asked us to leave.
By now, you've probably heard of COVID-19, or coronavirus disease discovered in 2019, which is responsible for a global pandemic. Thus far, the main country affected has been China, but it spread to a number of other countries around the world to a varying degree. The virus was initially referred to as the 2019 nCoV, or the 2019 novel coronavirus, and was informally called the Wuhan coronavirus. The World Health Organization named the disease COVID-19 because it doesn't refer to a geographical location, an animal, a person, or a group of people, all of which can lead to stigma. They also wanted to make it pronounceable and related to the disease, which is not an easy task. The virus was officially named SARS-CoV-2, or Severe Acute Respiratory Syndrome Coronavirus 2, because it's genetically very similar to the SARS coronavirus, which was responsible for, well, the Severe Acute Respiratory Syndrome, or SARS outbreak in 2002. So, SARS-CoV-2 causes COVID-19. In 2002, SARS was a coronavirus that hopped over from bats to civets, which is a cat-like mammal, and then over to humans. And in 2012, there was MERS, which was a coronavirus that hopped over from bats to camels a few decades ago, and then circulated among camels for quite some time before eventually infecting humans. But this time, the intermediate host was probably a pangolin, an animal that looks like a cross between an anteater and an armadillo. That's based on the fact that scientists identified a coronavirus in pangolins that's a 96% genetic match to SARS-CoV-2. Sadly, pangolins are heavily trafficked around the planet, largely because people believe that their scales have healing properties. And because they're moved around the world rather than just left in the wild, there are ample opportunities for a coronavirus to go from a pangolin to a human. The SARS-CoV-2 virus causes a respiratory disease called COVID-19. The virus probably originated from bats, and then went to pangolins as an intermediate host, and finally to humans. The virus travels in respiratory droplets and enters the body via the mouth, nose, or eyes. Once inside the body, it replicates in the respiratory system, causing symptoms like fever, cough, and shortness of breath. Some people might develop more dangerous complications like pneumonia, ARDS, and shock. Treatments are focused on supportive care, but certain medications like remdesivir are currently in clinical trials. In the meantime, the best strategy is prevention. This includes careful hand washing, avoiding traveling to disease outbreak areas and crowded places when possible, avoid touching your T-zone, and, if you're a healthcare worker, using personal protective equipment. Treatment is focused on supportive care, providing fluids, oxygen, and ventilatory support for really ill people. There's also some early data showing that 3 medications are highly effective against SARS-CoV-2 in the laboratory setting. These medications are chloroquine, an anti-malarial drug, ritonavir, an anti-HIV medication, and remdesivir, an antiviral drug previously used against Ebola. Remdesivir was given to the first U.S. patient with COVID-19 on day 11 of his illness as he was clinically worsening, and he began to improve the very next day. Large-scale clinical trials using remdesivir are already underway in China. Unfortunately, there's no vaccine currently available to protect against COVID-19. At best, it looks like a vaccine will be many months away. Human transmission, starting with isolating people with COVID-19. Coronaviruses don't usually spread over long distances in the air, but they can travel roughly 3 feet, or 1 meter, from one person to another on tiny droplets of saliva, which are produced when someone's coughing or sneezing. In addition, some strains of coronavirus can survive on surfaces for over a day. With that in mind, if you're a healthy person living in a non-outbreak area, the recommendation is to avoid travel to disease outbreak areas, generally stay away from crowded places, and stay at least 6 feet or 2 meters away from anyone with symptoms. Wearing a surgical mask is not recommended because the general risk of getting COVID-19 in these settings is so low. As always, careful hand washing is the key, and it should be done with soap or alcohol-based hand sanitizers and scrubbing. Also, avoid touching your eyes, nose, and mouth. This area is known as your T-zone, and it's a common entry point for viruses into the body. For healthcare workers who are around people with COVID-19, the recommendation is to apply droplet and contact precautions. That includes wearing personal protective equipment like a clean, dry surgical mask, gloves, long-sleeved gowns, and eye protection like goggles or a face shield. When performing a procedure that generates aerosol, like tracheal intubation, bronchoscopy, CPR, or non-invasive ventilation, it's important to wear an N95 respirator. This prevents 95% of the small particles, like respiratory droplets, from passing through.